CNC3.
Your heart beats, your lungs breathe, your kidneys filter every minute. Your brain performs calculations more complex than the world's most powerful computers. Most of us rarely stop to notice until something goes wrong. This evening we'll explore the extraordinary machinery of the human body, separate fact from fiction, and help you make better decisions about your health and well-being. Because good health is not simply about living longer, it is about living better. Welcome to CNC3's Ask the Doctor. Good evening, and live on Facebook and the CNC3 website. You can also like our Ask the Doctor page and follow my articles in Friday's Trinidad Guardian, with of course a new We Health column on Tuesdays, where your burning questions will be answered. But let's start with the Doctor's Capsule. There was a large annual meeting for the American Diabetes Association in New Orleans last week, and there is a new medication called retatrutide. It's being hailed as one of the most promising advances yet in the management of type 2 diabetes and obesity. So results from a major international trial show that this drug produced not only substantial improvements in blood sugar control, but also led to remarkable weight loss. You know, we've spoken about the GLP-1 receptor agonists that help in many aspects, working at the pancreas, the brain, stomach, and the intestine. And what makes retatrutide different is that it works on 3 hormone pathways simultaneously. So, of course, we know the blockbuster drugs like semaglutide will target 1 pathway. Tirzepatide or Mounjaro will target 2 pathways. Now, retatrutide is the first in its class that's going to target 3 key metabolic hormones involved in appetite regulation, blood sugar control, and energy expenditure. So exciting times. In this study, patients receiving the highest dose lost an average of more than 15% of their body weight in just 40 weeks, while also achieving major reductions in hemoglobin A1C. And we know that's a blood test that looks at your sugar control for the preceding 3 months. These results were substantially better than those who had a placebo treatment. And it's important because modern type 2 diabetes, as we know, is increasingly a disease of excess weight. In fact, perhaps we could coin that term diabesity. Many younger patients are developing diabetes at higher body weights than previous generations, making effective weight reduction a critical part of treatment. It's a part of the pillars in the management of diabetes. Experts believe that greater weight loss may translate into benefits beyond control of blood sugar. So we're looking at improvements in blood pressure, mobility, physical function, and the overall quality of life, because many of the complications of obesity will be reduced. Of course, like many of the other drugs in this family, the most common side effects in the study were gastrointestinal, including nausea, vomiting, but those were generally mild to moderate and tended to improve over time. And I expect with lower doses, the symptoms would have been reduced. Researchers caution that long-term studies, though, are still underway, particularly to establish safety with the heart and determine how retatrutide compares directly with existing agents that I mentioned, semaglutide and tirzepatide. So the findings really reinforce an important reality in modern medicine. As we battle this scourge of diabetes, we're entering an era where treatments for blood sugar are not simply about looking at numbers. When you're thinking about management of diabetes, they're reshaping weight management, metabolic health, and potentially the future course of this chronic disease. Further afield, a fascinating new study is raising questions about whether smartphones may have contributed to falling birth rates around the world. Researchers analyzed patterns of smartphone adoption in the United States and concluded that since the arrival of the iPhone and that smartphone era, there was a decline in fertility rates after 2007. The researchers suggest several explanations. So smartphones changed how people socialize. As more interactions moved online, time spent together in person declined. So there were fewer face-to-face interactions, which may possibly have meant fewer romantic relationships and fewer opportunities for sexual activity. Secondary, smartphones provided unprecedented access to online pornography, which some researchers believe may have acted as a substitute for partnered activity in certain groups. And thirdly, smartphones made information about contraception and reproductive health more accessible, potentially reducing unintended pregnancies. Now, it's just speculation, of course, but these effects appeared strongest among younger people. Researchers note that this Generation Z is the first generation to grow up almost entirely in this smartphone era. And what's interesting, though, is that separate studies have also linked widespread smartphone use to declining teenage birth rates worldwide, while raising concerns about increasing mental health problems among teenagers. And of course, when we think about smartphones and their use in schools, it's something that should be examined in this country. Now, it's unlikely that just the use of phones will be the whole story when we look at declining birth rates. Of course, when you think about economic pressures in the world, this was exacerbated since COVID, changing social norms, delayed marriage, persons seeking increased schooling at higher levels, and access to family planning. These will all play major roles in fertility trends. But the findings highlight an intriguing possibility. That could it be that one of the most influential inventions of the 21st century may not have only changed how we communicate, how we work, how we socialize, but perhaps how families are formed? So researchers are continuing, of course, to explore the long-term effects of digital technology. But one thing is becoming increasingly clear. Smartphones have transformed far more than our screens. They may also be reshaping society. There was a thought-provoking commentary in the British Medical Journal, and it was using a recent controversy involving self-proclaimed sleep experts or sleep fairies, you know, the tooth fairy, sleep fairies, to highlight a much larger public health challenge, where people actually get their health information. I know our viewers look at Ask the Doctor, but this controversy erupted after an investigation revealed that there were unregulated online sleep consultants who were providing potentially dangerous advice to exhausted parents seeking help with infant sleep problems. So health officials described the advice as misinformation presented as expertise. And it brings to the front burner, why are so many parents turning to social media for health advice in the first place? Because we are desperate for answers at 2 o'clock in the morning when a baby won't sleep. And when really you're faced with limited appointment times and overstretched health services, it's easy to turn to Facebook groups, Instagram influencers, and online forums for immediate support. Now, influencers succeed not necessarily because they have expertise, but because they're accessible, relatable, and available around the clock. So traditional public health messaging often struggles to reach people where they actually seek information. So I think it's a lesson for medicine. It extends far beyond a sleeping infant. Whether the topic is nutrition, vaccines, diabetes, weight loss, or mental health, millions of people now receive health information through social media rather than traditional healthcare channels. Public health must adapt to this reality by developing trusted voices. These voices must be evidence-based when they're online and try to engage our people on the platforms they already use. So the message is simple but important. In today's world, providing health information is not enough. It must also be accessible, people must understand, and it must be available when people are looking for it. Because when trusted experts fail to answer questions, somebody else will. June 14th marks World Blood Donor Day, so that's a global celebration of the millions of people who quietly save lives without ever meeting the individuals they help. Every day, blood is needed for surgery, trauma, childbirth, cancer treatment. Go through the wards, you'll see patients with sickle cell disease, thalassemia, and many other medical conditions waiting for blood. So yet, despite all the advances in modern medicine, there remains one thing that scientists cannot manufacture in a laboratory: blood. Every unit comes from a human being willing to roll up a sleeve and donate. But you know what makes blood donation remarkable? It's anonymity. You don't know the donor. A donor may never know where their blood goes. They may never meet the mother whose life was saved after a complicated delivery. They may never meet that accident victim who survived a major trauma, or the child receiving blood for a disorder. But their gift becomes part of another person's survival story. We'd like to encourage you that a single blood donation can potentially help multiple patients, because blood is separated into different components like red blood cells, plasma, and platelets. This year's World Blood Donor Day theme reminds us that blood donation is more than a medical act. It is an act of community, compassion, and generosity. So at a time when headlines often focus on what divides us, whether it's politics, race, work, blood donation offers a powerful reminder of what connects us, because blood does not recognize race, it does not recognize religion, politics, or social status. It simply saves lives. So if you're healthy and eligible, consider becoming a blood donor. Because somewhere, perhaps even today, a patient is alive because a complete stranger decided to help. And in the future, that stranger could be you. It's time for a short break, and when we return, the Medical Mind segment is up next.
Lucozade, bring the energy. Unbeatable taste, new look.
What if we each took one small action today that could have big impact tomorrow? What if one family took a stand to reduce waste in our landfills? What if one school made a choice that can lead to a greener Trinidad and Tobago? When you recycle glass, you create jobs, reduce waste, save resources, and help preserve our environment. Glass bottles and jars are 100% recyclable and can be reused indefinitely. Recycle your glass and join the Glass Loop movement today.
Visit Tire Clinic Marketing, New Truck and OTR Tire Service Center at number 30 and 32 Montrose Main Road, Chaguanas. Call today at 665-8973 or 672-3419. Alignment services available. Tire Clinic Marketing, Truck and OTR Service Center. A tire for every need.
Period nights don't have to look like this. Move less, wake up to change. So change for a real night's sleep with Always Overnight. Its 3 times protection system absorbs, locks the fluid, and keeps it away from your skin. For protected nights without leaks. Always.
Welcome back to the #1 show for news, views, and interviews of all things medical. Now, dental health is more than what many people will realize. The mouth is not separate from the body. Gum disease has been linked to diabetes, heart problems, inflammation, and even pregnancy complications. This evening on Medical Minds, we explore the fascinating world behind a smile with one of Trinidad and Tobago's most respected dental surgeons. Let's welcome no stranger to the Medical Minds segment, Dr. Dion Kunulal.
Hi, I'm Dr. Dion Kunulal. Thank you to Ask the Doctor and Dr. Tilak Singh for having us. Today, we're talking about root canal treatment. And I want to have a fair right up front. because the phrase root canal makes plenty people tense up. A root canal is not punishment. It's a tooth-saving treatment. The goal is to remove infection from inside the tooth and help you keep the natural tooth instead of losing it. Let's make it simple. What is a root canal in plain language? Inside every tooth, there's a soft tissue called the pulp, and that's where the nerves and blood supply lives. When that pulp gets inflamed or infected, the tooth can start giving serious trouble. A root canal is where we carefully remove that infected tissue, clean and disinfect the inside of the tooth, shape the canals, and then seal it so that the infection can't come back. How do you know you might need one? Some people feel a deep, throbbing toothache, pain when biting or chewing, swelling or gum pimple near the tooth, or sometimes no pain at all, and we only see it on an x-ray. That's why I always say, don't guess. Does a root canal hurt? Here's the honest truth. With modern dentistry and proper numbing, most people feel little or no pain during the procedure. In fact, it's often more painful walking around with the infected tooth than doing the treatment. What actually happens during the appointment? First, we numb the area so that you are comfortable. Then we access the inside of the tooth, remove the infected tissue, and clean and disinfect the canals. After that, we seal the tooth. Some root canals can be completed in one visit. Some take 2 visits, some take 3 or 4. It all depends on the tooth and the level of infection. Why do people sometimes need a crown after? That part is important. After a root canal, the tooth can become more fragile over time, especially if it had a big cavity or a large filling to begin with. Very often, we recommend a crown to protect the tooth long term so it doesn't crack. What should you expect after the root canal? As the numbness wears off, it's normal to feel some tenderness or soreness for a few days. Most people do fine with some simple pain relief like paracetamol or ibuprofen once it's safe for you to take. And be gentle with that tooth, especially if it's the final restoration completed. When should you call the dentist? If you get swelling that gets worse, fever, strong pain that isn't settling, or something feels off, don't try to tough it out. Call and let your dentist review. Root canal treatment does not cause cancer or mysterious diseases. That's a myth that keeps floating around online. The reality is, root canals are done to remove infection and to help you keep the tooth. If you have been told you need a root canal, I know it feels scary, but you don't have to face it anxious and guessing. Go to your dentist, talk it through in plain language, let them focus on your comfort as we take it step by step, as the goal is always the same, to get you out of pain and keep your smile healthy. I'm Dr. Dion Kunalal, and thank you for watching. Take care of your smile.
And we say a special thank you to Dr. Dion for his love, service and support, and indeed best wishes to the entire Kunalal family. Now it's time to put your medical knowledge to the test, and our wonderful audience members are ready to take on the challenge. The giveaway segment with the compliments of Great Health Works is coming up next.
Let's do this. You can get the help you need to succeed with Rand Credit Union. You can believe that you can achieve. Big goals, small ones too. Rand Credit Union, we've got you. No more waiting, that won't do. Make someday today. One life, so make it good. Live the way you know you should. With Rand Credit Union, yes you could. Make someday today.
Live your best life today with Rand Credit Union.
Looking to give that extra support? Get the neoprene magnetic support wraps to provide firm compression and soothing magnetic support for your ankles, wrists, knees, waist, and more. Comfortable, reusable, built for everyday relief. Improve circulation. Choose neoprene magnetic support wraps today. Make long drives more enjoyable for dad with a magnetic car and a chair seat. Designed to ease tension and help you relax while you sit. Release aches and pains in the back and shoulders. Call 653-0011.
Magical Expressions Limited is the largest local importer and distributor of fresh cut stems, offering the widest range of beautiful flowers at the most affordable prices. Call us today at 701-6488 or visit our website to order.
It's giveaway time with the compliments of Joseph Sandel and the rest of his superb team at Great Health Works. We'd love to hear from you, and it's your opportunity to not just call in, but also to win a prize. The number's on the screen, and as a reminder that when you're patched into the studio, listen on your telephone rather than the TV set, because there is a delay that creates confusion. As a reminder, we're live on Thursdays at 8 p.m., but if you're watching by chance on a Friday, it's a rerun at 11 a.m. or Saturday at 11:30 a.m. So don't use World Cup football as an excuse for missing your favorite program. So our question this evening: what surgical procedure involves the removal of breast tissue and is often used to treat or prevent breast cancer? So a surgical procedure, what's the medical term, involving the removal of breast tissue to treat or prevent breast cancer? So it's a common term used in some places, including the medical field, but also I think should be familiar to laypersons. As we head to Waterloo, good evening and welcome to our show.
Hello, good afternoon.
Thank you for being part of our Ask the Doctor family. Good evening.
Good evening. It's the mastectomy.
Congratulations. Our first caller is also the winner, a mastectomy. So that's the name of the procedure used to remove breast tissue, usually for some of these unfortunate conditions. Well done. Have you used these supplements before?
Yes, I have tried it.
What was your experience?
It works really well. Yeah, I'll recommend it to anyone.
And I'm sure that our sponsors would be delighted to hear some more from you. Stay on the line because we want to take some of your personal information off the air. And what an honor it was to have you as our Ask the Doctor winner this evening, a mastectomy. And we want to hear from so many more for beloved viewers, because coming up next, it's the Open Forum. This is your platform to ask questions of a medical nature. Get ready for that.
Welcome to Holiday Inn Express and Suites.
Do enjoy, Stacey. You want some coffee?
Can I have a
Perfect then.
That's exactly what we need.
Hi, the pool is this way.
Whatever you're here for, we're here for you. Stay smart at the Holiday Inn Express and Suites.
Things don't always go as expected. Be ready with Trinry for auto, home, business and group life. Call us at 800-TRIN or visit trinry.com today. Huge insurance premium. Pay your premiums bit by bit with FlexiPay from Trinry. For more manageable auto, home and commercial insurance payments, call us at 800-TRIN or visit trinry.com today. Trinry. Premier insurance coverage for less.
The detergent smells nice while washing, but when you use the new Downy Intense fabric softener, with its new multi-capsule fragrance, it releases an intense scent that lasts twice as long. With the new Downy Intense, you'll enjoy a rich and delightful fragrance that keeps you feeling fresh 24/7.
Attention all listeners, are you ready for the ultimate news experience? Introducing the Trinidad and Tobago Guardian, the nation's first and most subscribed newspaper. We deliver where others can't. With the widest delivery network in TNT, you can have the Guardian delivered right to your doorstep or office every single day. Take advantage of our special annual subscription offer so you can stay on top of the leading stories even when you're on the go. Sign up today. Time is running out. Inquire about our 3-month and 6-month packages as well.
Welcome back to the open forum of CNC3's Ask the Doctor. So just thought that sometimes it would be the ideal chance for you to call in. We're not attempting to make a diagnosis on the basis of the telephone call, just to nudge you in the right direction so you can liaise with your doctor for a better, more rounded clinical encounter. And the number's on the screen, and as we mentioned, when you're patched into the studio, listen on your telephone rather than the TV set, because there is a delay that creates confusion. Apart from World Cup football, I know a lot of children are in the midst of exams as we close this school year, and we certainly wish God's blessings to all of those doing higher exams, and indeed those awaiting SEA results and even end-of-term tests. So, we were talking a little bit about the scourge of diabetes as part of the opening salvo. There was this huge meeting called the American Diabetes Association in New Orleans, and at that meeting, the front burner discussed, apart from the complications like the leading cause of blindness in working-aged persons, a leading cause for end-stage kidney disease, non-traumatic loss of limbs, you were 2 to 3 times more likely to have a heart attack and stroke. They brought new medications, so there are new drugs on the pipeline. One thing I didn't mention, which I want to emphasize, is that these must become available in the local setting because the benefits go beyond blood sugar. There may be protection with the heart, kidneys, weight loss, so a plethora of advantages with this novel class of drugs called the GLP-1 receptor agonists. Our first caller hails from Diego Martin. Good evening and welcome to Ask the Doctor.
Hi, good night.
Thank you for being part of our program, ma'am. Welcome.
Hi, good night, good night. I have a quick question. I am 45 years old, and when I open like a tin of tuna or like a can of soda or something, my 2 fingers swell up the next day. What could be the cause of that?
Okay. Thank you very much for taking the time to call in. So if you're using your fingers, especially with a can and you're pulling, there is some degree of trauma, and it implies that there may be a level of inflammation occurring within the joints and tissues. Now, I'm not sure if you have any major complaints, if you've been admitted to hospital before, but it might be worthwhile to mention to your doctor that simple actions like twisting or to pull a tin might cause some level of inflammation. Some basic blood investigations may be on the cards. If the fingers remain swollen, if they're warm, tender, this may also indicate inflammatory types of arthritis. So I don't know how long they last for, but basic blood tests, I think, may shed some light, particularly as you're 45. You're doing this as part of a general physical exam at least once a year, apart from blood sugar, blood pressure, cholesterol. Perhaps there are some simple tests, inflammatory markers, and younger women also have to remember there may be immune-mediated problems that can attack joints, things like rheumatoid arthritis or lupus, so there may be antibodies which can attack your joints. So it's all based on how long your symptoms last. It may be simple trauma and then it goes after about a day, but if they're swollen, painful, stiff, worse on the mornings, these may be all red flags that require a chat with your primary care doctor and then even a consultation with a specialist. Well, that's an excellent question to open a batting because it's non-specific, so it means that we have to delve a little bit to find out why this may be occurring in a young, ostensibly healthy lady. As we head to Central Trinidad next, good evening and welcome to our program.
Hi, good night, doctor.
Thank you for being part of our family, ma'am. It's a pleasure to have you on.
Quick question.
Yes, ma'am.
I'm having a tingle on my leg, on my upper leg.
Yes.
Something feeling numbish and painful. I'm the age of 45.
Yes.
So I don't know how to explain it. Sometimes if I touch, it feels burning,
yes,
like a burning sensation, but it is always there. At times that it feels less painful than others.
And it's just one part of the leg has those symptoms?
I didn't hear you.
And it's just one part of the leg has this problem, like the burning and tingling?
Yes, on my arm. thigh, outer thigh.
Yes, ma'am. And thank you very much for taking the time to call in. Now, it's a fascinating set of symptoms because it could represent the involvement of nerves. And we've had persons, especially those with a history of diabetes, who may call in with a similar set of burning, numbness, pins and needles, a lancing sensation to the hands and feet. The term is neuropathy, neuro meaning nerve and pathy meaning a disease. Now, down the side of the thigh, and it may begin at the buttock and even extend to the toes, sometimes there may be nerve impingement from the back, and that main nerve is referred to as the sciatic nerve, and some people may find it shoots and lances. Now, it may be constant, it may be intermittent, some people it may be so debilitating it affects their quality of life and sleep. So it's important that your doctor would want to do some basic bloods once more, just like our young lady from Diego Martin with that non-specific swelling to her fingers. You also require some basic tests. Your blood sugar for sure. Those persons who drink large volumes of alcohol would want to be vigilant about the same. You may want to do a thyroid function, kidney or liver function if you haven't, and of course the doctors usually examine persons who have had a history of cancer or treatment for such as chemotherapy or radiotherapy, because these nerves may sometimes be damaged. That's in general for persons with neuropathy, but in your case it's on the outer part of your thigh, and it would involve an examination, perhaps the lower back. Is there impingement of the nerve, the so-called pinched nerve as we say in the vernacular, and that is causing symptoms down the buttock and legs? Do you require nerve conduction studies? Is physiotherapy going to be part of your management? Is there a low level of vitamin B12? So if the symptoms are persisting, there are medications too, and for the sake of our viewers who may be having very bad symptoms affecting their quality of life, these may range from gabapentin, pregabalin, duloxetine, and there's even one available on CDAP, which belongs to an older class of drugs used for neuropathy. So apart from diabetes, which is the commonest cause, there is a plethora of reasons for having nerve involvement. I wish you all the best, but start with some investigations to determine the underlying cause. There may be some simple forms of treatment to alleviate such, and then if further tests are warranted, a neurologist is actually the specialist that deals with problems affecting the brain, spinal cord, and these peripheral nerves. Hello, welcome to Ask the Doctor. Good evening, you're on the air.
Hello, good night.
Welcome, sir. Thank you for being part of the open forum.
Doc, I called to let you know, I am 60 years of age.
Yes, sir.
And I am calling from Cuba.
Welcome.
I am diagnosed with diabetes, right? And I have taken a tablet called metformin.
Yes, sir.
So I want to know, not the doctor tell me that other people, when I tell people I taking metformin 2 in the morning and 2 in the evening, then people tell me that all this metformin have side effects that, it could damage the kidney. Not no doctor tell me that, they're people.
Yes.
So I call in you today to ask you what side effects does it have, metformin, if it do have anything that I could have to, look out later on. Thanks very much.
You're most welcome, sir. That's a fabulous question, because metformin remains one of the first-line drugs in the treatment of type 2 diabetes. It's an old classic. It's been around for more than 60 years in the management of high blood sugar. And boy, is it a good tablet, because it helps with persons who have insulin resistance. It may reduce the excess production of sugar from the liver, and it may even help with weight. There were some small studies suggesting it could be beneficial to the heart too in those battling the scourge of type 2 diabetes. And in fact, most people stay on metformin as the years continue and they change their drugs. Metformin remains one of those tools in the therapeutic armamentarium for this scourge. Now, it's an old drug, it's quite safe for most people, and perhaps the commonest side effects for those who are now prescribed this drug may range from nausea, vomiting, diarrhea, perhaps a tummy upset. If you've used it for many years, your doctor may be interested in doing a B12 level because they may be declining on a blood test if you're using this drug as a result of reduced absorption. I think the misconception amongst the general public about metformin stems from the fact that if diabetes, hypertension, or an unrelated medical cause damaged your kidneys, the doctors would then stop metformin because it may increase the level of lactic acid in your blood. So there is an uncommon complication in persons who take metformin with kidney failure, liver disease. If you have chronic use of alcohol, you may want to be particularly vigilant because lactic acidosis may be that uncommon side effect or risk associated with metformin. So if your kidneys have been damaged from uncontrolled diabetes, then your doctors would stop metformin. It's available on CDAP and also throughout both private and public sectors. Remain on that drug. Your doctors would want to not just do basic blood investigations, in this case the serum creatinine. There's also a mathematical formula called the estimated glomerular filtration rate, or EGFR, that you may sometimes see on blood tests to tell you how well the kidneys are filtering. And at least once per year, all persons with diabetes should have a urine test sent to the lab for microscopic amounts of protein, because apart from being a marker for kidney damage, it's also a risk factor or a risk marker to see if you have heart problems. So microscopic amounts of protein should be sought in the urine in all people with type 2 diabetes annually. And if you have type 1 diabetes, so those are younger persons who are taking injections of insulin, usually perhaps 5 years after the diagnosis, you should start doing this test for microscopic amounts of protein. So it's not the metformin in this case that would be detrimental to the kidneys. I think the misconception stems from the fact that when you have advanced kidney disease and your doctors are monitoring blood tests, the kidneys are being damaged from diabetes, hypertension, and so forth, then they may want to switch your metformin to something that will be eminently safer. And having said that, there are novel drugs on the market. We mentioned about the GLP-1 receptor agonist, those injections that help with weight loss. They also protect the kidneys. Another class of drugs that help you excrete glucose in your urine, and the acronym is SGLT2. So, and those drugs are also available to help heart and kidneys. Our next caller hails from St. James. Thank you for waiting and good evening.
Yes, good afternoon, doctor. Good night.
Thank you for being
This is a very strange question, but I have to ask it because nobody seems to know what it is.
Yes, ma'am.
I love to cook, and I'm constantly cooking, right? I just love to cook. Yeah, but my problem is that when I cook with a cupful of rum, in my meat and that sort of thing.
Yes, of course.
And I want to know if that would send up my sugar. If that, because I'm cooking it, and I thought, well, once it's cooked, it should not send up my sugar.
Yes, ma'am. And it's a small amount, and I would expect that it would be certain parts of the menu would involve that cupful of rum. The truth is, we know that we must be particularly vigilant when it comes to alcohol and blood sugar control. And rum is a byproduct of sugarcane. Persons who imbibe large quantities may find that their blood sugar levels may be very erratic. In fact, if you drink certain types of alcohol without eating, your blood sugar may actually plummet. So there may be hypoglycemia. So I'm glad that you're a delightful chef. I wish that you could send some for us or ask the doctor. Continue doing so. I think a small amount on various parts of the menu should not be harmful or detrimental to your blood sugar control. Do so, and if you want to be very certain, why not check your blood sugar if you're a person with diabetes, perhaps 2 hours after the meal, because one of the goals that we look at should be, at least based on the American Diabetes Association, they advise less than 180 milligrams per deciliter 2 hours after eating would be a reasonable level of control. In fact, some of our patients now have continuous glucose monitors, so it may be stuck onto the arm, and they're actually getting readings from their smartphones. So if they eat different meals, they can actually ascertain the impact on blood sugar. So one size doesn't fit all. Go right ahead, have a chat with your doctor, but why not get some objective evidence by actually looking at your blood sugar control after indulging in a healthy meal of fish or chicken. It's time for a short break, and when we return, there'll be more questions on Ask the Doctor. Get ready for that.
In every room, Vision sets the standard. For a limited time only, get your progressive transition lenses with an anti-reflective coating, designer frames, and eye exams. Starting at $16.50, only at Seaview Optical. Affordable eye care for everyone.
Give the 4-in-1 massager with slimming belt, far infrared reflexology magnetic therapy, nerve and muscle stimulator for the entire body. Relieve fatigue, soreness, injuries, pains, stiffness, varicose veins, and more. Does Dad snore a lot? Help him improve his sleep with the magnetic snore free. It increases airflow and oxygen to promote a more relaxed and restful sleep.
Knee heating wrap. Relieve knee pains associated with chronic arthritis, reduce stiffness, and increase flexibility.
Call 653-0011.
Welcome back to the open forum of CNC3's Ask the Doctor. The phone lines are burning up, and it's a fascinating medley. Hello, good evening, and welcome to our program.
Good night, Doc. I enjoy looking at your program.
Thank you.
It's very informative and it's very useful and practical.
Thank you for your kind words.
My wife has an actual problem of trigger finger.
Yes.
It's given her some problem. Is there a remedy for that?
Yes, sir, and thank you very much for taking the time to call in, because it's a common problem. Sometimes it's associated with hardworking individuals, those with diabetes. We mentioned problems like rheumatoid arthritis. It's where there may be a thickening of the tendon, which is involved with flexing the finger. And for the sake of our viewers, so the finger flexes, and sometimes, like a gun, you actually have to force it. So hence the term trigger finger. So, and it may be very painful, stiff, and associated with a reduced range of motion. It's a common clinical issue, and persons may require anti-inflammatories. Sometimes there are physiotherapy or various types of exercises which may be available freely online, but a steroid injection into the finger would be under the remit of your family physician or perhaps an orthopedic doctor before thinking about surgery. So the surgeon who specializes in muscles, bones, and joints is an orthopedic specialist and would want to consider the injection of a steroid because of its anti-inflammatory effect. Of course, you would want to ensure that your blood sugar is under immaculate control before doing so. So a person with diabetes, use of the hands, certain problems such as rheumatoid arthritis may be at an increased risk of the trigger finger. It resembles the trigger of a gun, may be very painful, but to reduce that inflammation, ranging from simple remedies to physiotherapy and exercises. Following that, if there is no ease, a referral to the orthopedic specialist for a steroid and surgery as a last resort. Hello, good evening. Welcome to the open forum of Ask the Doctor.
Yes, good evening, Doctor.
Yes.
I'm a regular listener of your program, but my problem is my hand. I have a numbness in my left hand.
Yes.
The right hand is just slight, but it's red pronounced on the other hand. I want to know if that will be a permanent numbness or if there's anything that I can do to improve it, to how it works.
Thank you very much. Because that is also a common complaint, and that numbness implies there is nerve involvement at the level of the hands. Now, once more, there is a disclaimer, I'm not attempting to diagnose. Based on which part of the hand, if there are certain fingers, there may be entrapment of a nerve, perhaps at the wrist. There is one called the median nerve, and the thumb, the first two fingers, and perhaps half of the third or ring finger may have a numbness, burning, tingling. That is referred to as carpal tunnel syndrome. The symptoms may be reproduced if you tap at the wrist or if you flex that joint. And it may require some further testing involving a nerve conduction study and a referral to the neurologist, or as I mentioned, the orthopedic surgeon. Some people may find that the nerve may be pinched at the neck if there is impingement. We discussed as part of the pain that radiates down our legs associated with sciatica, there may be nerve impingement from the lower back. That part of the spine in the neck is called the cervical spine. And if there is impingement there, the symptoms may begin at the shoulder and radiate to the hands. There may be numbness. And if there is entrapment of a nerve called the ulnar nerve at the elbow, there may be numbness. So it's unclear as to why it may have occurred. But as I mentioned earlier, there are many reasons. Diabetes, alcohol use, a low level of B12, certain medications, underactive thyroid, even antibodies may attack the nerves. So a doctor would want to start with basic tests. After a physical examination, does he or she need to look further in the neck or the cervical spine? Is a nerve conduction study warranted? Physiotherapy. Sometimes if there are low levels of vitamin B12 and they become replete, the symptoms improve. If you switch or change the medications, this may also help with the numbness. So physiotherapy is first line, and then based on investigations such as scans, a referral to an orthopedic surgeon or even a neurologist would be latter stages in your management. So there are steps in that ladder when we're thinking about the management for neuropathy affecting the hands, and I wish you all the best, because apart from being common, it's also difficult. It may be associated with problems holding objects. Sometimes these may fall. Some persons find that doing day-to-day activities become more arduous as a result of this numbness. And I wish you all the best in getting an answer to not just your symptoms, but also to determine if there is an underlying problem that needs to be treated. So the simple answer to your excellent question is that it may not be long-term, but the reason for the numbness needs to be elucidated. A final call hails from Gasparillo. Good evening. Thank you for being part of our family.
Hi. Good evening, doctor.
Welcome.
I am 65 years old, soon to be 66.
Yes.
And I'm having some problem with my legs, some pain, and then like on my left ankle it is swollen, and like the middle of my left feet, from the middle going to the back of the heel, not by the toes. I have a lot of pain here. Could you tell me what I can do, if there are a remedy or medication I can use for that?
Yes, ma'am.
Thank you.
Yes, ma'am, and you're most welcome. Thank you very much for taking the time to call in, because a swollen, painful, warm, red joint, you would want to consider whether there is some level of inflammation that might be existing. The word arthritis actually translates to inflammation of the joints, and this may of course affect certain areas such as the ankles. It's not just due to wear and tear. Some people, even at 65, may have antibodies attacking various joints. That's due to rheumatoid arthritis. The level of acid may be high sometimes, and these may be deposited. This is called gouty arthritis. So some basic blood tests. Your doctor may want to do x-rays. And I haven't mentioned the possibility, of course, about circulatory issues, but sometimes in hands as well as in the lower limbs, persons may need to be vigilant about blockages to the arteries. The term is peripheral arterial disease, and the risk factors are similar to those which may cause plaque to form in the arteries that lead to the heart. Things like diabetes, hypertension, high cholesterol, smoking, obesity, and a sedentary lifestyle. So problems with the veins may actually cause cramping, swelling, and pain. So it's difficult to be sure what may represent the underlying cause. I rather believe that you have a mixture of joint issues, and perhaps there may be problems affecting the circulation to the veins. Many post-menopausal ladies may wish to explore this as a possible reason for symptoms. The nerve involvement, we spoke about the sciatic nerve that radiates from the lower back, the buttocks and legs, can also create that burning, lancing sensation. And there may be even medications that are prescribed for unrelated clinical problems, such as amlodipine for hypertension, a common drug used and it's available on CDAP and throughout the healthcare industry. Amlodipine may cause swollen ankles at different points. So you have a mixture of problems affecting the lower limbs that require not just blood tests or not just anti-inflammatories that would be available in the pharmacy or from your doctor. Those are all parts in the management, but I think the diagnosis still needs to be clarified. And that perhaps is one of the themes on this show, that we're not attempting to diagnose, but however, to nudge you in that direction so that you can make the appropriate and right clinical solution, in conjunction, of course, with your doctor and all of the allied healthcare professionals. Well, parting is always sweet sorrow in this program. I've missed you for a few weeks. I know we had some reruns, but our closing quote is from John Green and his book, Looking for Alaska. The only way out of the labyrinth of suffering is to forgive. The only way out of that labyrinth of suffering is to forgive. Now, forgiveness is rarely easy. Sometimes it takes years. Sometimes it occurs in stages rather than all at once. But yet Green suggests that without it, we wander endlessly through corridors of anger and sorrow and ill health. The insight is both literary and deeply practical. Suffering may bring us into the labyrinth, but forgiveness is often what leads us home. Some words of wisdom this evening. And thank you for trusting me to walk beside you each week, in your homes and in your hearts. To my wonderful team behind the lens, to the gracious and compassionate Neela and baby Daniel, belated birthday blessings to him. And to you, our viewers, stay curious, stay strong, and never stop choosing kindness. Rest, reflect, and love deeply. God bless. We'll see you next week on Ask the Doctor.